Hello, everyone. My name is Melissa Homer, Chief Cleaning Officer of MaidPro, and I'm here to talk to you again about masks. If you watched my course, Corona Ready Cleaner, you probably recall when I said this. Now, everyone's going to ask me, what about masks? Let's be honest. You can't get them anyway, so stop stressing about it. But even if you could, it's a pointless activity at the moment. Well, about that. So we've got a critical update, which is, in case you've been living under a rock, the CDC has changed its direction from originally stating that masks were not necessary to they are now an incredibly important part of fighting this disease. So we now have to change our question from not just what about masks to what changed about masks. Now you may be thinking, the CDC got it wrong. But actually, they didn't get it wrong. They changed their perspective, which is such an important thing to do when you're studying anything. When they first looked at the issue of containing this disease, they thought about masks, as we've always thought about them, as personal protective equipment, PPE, which is all about protecting yourself. And they knew at the time that there was a shortage of the style of masks necessary to filter out tiny virus particles. And so they said, well, gee, don't bother. The masks you could get a hold of are not going to be filtering enough to protect you. So it's not going to work. But then they changed their perspective. And they thought about, instead of, I'm just going to protect myself, can we all protect each other? And they shifted the idea from PPE, personal protective equipment, to CPE, community protective equipment. Can I wear this mask to protect you, and you wear this mask to protect me? And when they changed their perspective, it changed everything, because it turns out the requirements for a mask that can keep your germs in are far simpler than a mask that can filter out microdroplets from far away. It turns out any old mask, fabric mask, disposable mask, whatever you can get a hold of, will actually do a pretty darn good job keeping your germs to yourself. And if everyone's wearing one, there's far less in the air for you to breathe in and make you sick. So that perspective change from PPE to CPE is what really changed. And the change is beautiful. It's selfless. And it's really cool science. So speaking of beautiful, let's check out our pros in their new community protective equipment. MaidPro branded, of course, allowing you to see that, showing the world that you care about them and your customers that you care about their health can really look quite stylish. Who knew? Protecting others is beautiful. And it's as simple as your face mask, disposable gloves, safety glasses, protective booties. These are all going to keep you either from breathing out germs you shouldn't into the community or picking up germs you shouldn't onto yourself. And the safety glasses are, again, just to keep you from bonking your eye. Easy, right? So now that we know how stylish and effective masks can be, let's talk about how we take care of them. Let's talk about mask maintenance and ask ourselves the question, what are the rules for masks? And the rule is simple. Think of your mask like you would any other article of clothing that you wear close to your skin, whether it's gym socks or a t-shirt you wore out gardening or any other sort of undergarment. The rules are exactly the same. You'd never wear stinky old sweaty socks from yesterday because you haven't had a chance to wash them yet. You'd never run around in a dirty shirt you wore gardening covered in dirt and germs because, well, I'm supposed to wear it all day. It doesn't matter if it looks gross. You know better. Same rules with your masks. And the rules are simple. Wear a fresh mask every day. At the end of the day, wash it. If it gets something disgusting splashed on it, take it off and put on a fresh one. If it gets all holed and torn and otherwise disfigured, it's time to toss it and get a new one. Think of it like you would any pair of underwear or socks or t-shirt or any other clothing you wore close to your skin, and you know what to do already. Easy, right? Now let's talk about how to wear the mask properly. To wear the mask properly, I'm gonna have to show you by wearing one. So forgive me if it muffles my sound a little bit. The top mask mistakes are, when you put your mask on properly, it just sits along your nose, along your cheeks, along your chin, right? Well, the top mistakes are, you let your chin pop out because it's too small for you, or you've got your nose popping out because you think it makes it easier to breathe, even though now all the germs are shooting over from your nose. You got it so tight that you can't talk, or so loose all the air is flowing up the nose sides and out the sides and out the bottom and not actually getting filtered through the cloth like it's supposed to be. Or you got it on right, but then you're touching it all day long, touching that dirty house full of germs and getting it all over your mask. Or worst of all, you're constantly taking it off, defeating the purpose of it. The right way to wear a mask is tight enough that it's making a seal all around your face as much as possible. You want the air to go through the mask, not up and around. And you want to wash your hands every time you touch the mask, either with Purell or some other sanitizer or soap and water. Because again, if you've been touching your dirty house and then touching your face, you'd have no idea what's on there. Easy, right? Which now brings us to the question of, what about those filtering masks, those KN95s or N95 masks? The reality is, right now, there's still a nationwide shortage that's probably not going away for a while. But since I want this update to last, I'm going to talk to you about them now in case you are able to track some down in the future. N95s or KN95s, KN95 is the Chinese standard, N95 is the US standard, are a type of filtering mask that actually can filter down fine enough particles to stop viruses. But most people, particularly most house cleaners, have never been properly fit test for these type of respirators. A fit test is when you put this mask on and make sure it has a perfect seal around your face, and they put a big old hood on you and spray all sorts of stuff in there that you try to breathe in for like half an hour to see if it sneaks in anywhere, if you can smell anything and taste any bitterness in the special spray. It's a whole thing, okay? And if you have not gone through that process, that means you have no idea if your KN or N95 mask fit you well enough to actually filter out everything. So if you track down some of these masks, they can provide you some additional protection in terms of the germs that are in the air. They can filter them better, but you cannot rely on them the way a healthcare worker does to break that 6-foot social distancing. You must maintain social distancing even if you track down one of these masks, because you have not been properly fit tested to ensure the proper full seal all around the nose, sides, edges, etc. But again, if you get a hold of them, they're great. But we have to conserve them because, again, they are of limited supply, and we want to make sure as many as possible are going to healthcare workers, and we're getting the non-sterile packaged extras that still should be, again, conserved until there's a chance for the manufacturing community to catch up to the need. So what does that conservation look like? Let's talk about the KN95 rotation plan. If you happen to track down some of these masks, you're going to need a minimum of at least 3. And you're also going to need 3 cloth masks to put over them to protect them. So once you track down those masks, that's going to be 3 sets. Set A, set B, set C. In each set, there'll be a cloth mask, a KN95 mask, and a plain old brown paper bag. And take an old Sharpie and just mark them all up so you know which one's which. Easy, right, so far? Cool. Each day at work, you're going to want to put on that KN95 first and smooth it over your nose. Make sure you get as tight a seal in your face as you can. And you're going to put your fabric mask over the KN95 mask to protect it from soils in the air and soils on, the surfaces that you might accidentally touch your face. So that fabric mask is going to protect your KN95 mask and help you keep it longer. Easy, right? Wear it all day just like you would the normal fabric mask. Anytime you touch it, again, you're still going to need to sanitize your hands or wash them. At the end of the day, what you're going to do is you're going to take them aside, and the fabric mask, you're going to wash it. Hand wash it, washer, dryer, whatever you get a hold of, launder it. The KN95 cannot be washed. And whatever YouTube tells you, don't try sanitizing it in the microwave in case you enjoy fire. So don't do it. it can't be properly cleaned unless you have a special factory to do so, and you're not a factory. So your only option is to let it dry out. You're going to take that KN95 and plop it in an open brown paper bag. That's it. Just let it sit there. It's going to air dry. In around 24 hours, the germs that are on the mask should die, but we're going to let it sit there for several days just to be sure. Because COVID-19 does last 24 hours on porous surfaces like cardboard and stuff, but we want to give it an extra couple of days because, let's not mess around. The next day at work, you're going to wear set B. Again, KN95 first, fabric over it, wear it for the day, wash your hands when you touch it. At the end of the day, just like last time, we're going to take the KN95, plop it in our brown paper bag to store, and the fabric mask we're going to wash. Do the same thing for day C. So Monday, Tuesday, Wednesday now, right? By Thursday, that set from Monday has been airing out for several days, is good and dry, everything's on it's good and dead, and the fabric mask, if we hand washed it, has long since hung dry, and everything is ready to be used again. And so we can start all over. How long you can keep that KN95 mask is totally up to usage. If something nasty splashes on your face, you may not be able to use it past that first day. If it gets torn or worn or crumpled and it's no longer making a good seal on your face, or it gets smelly or soiled inside, really nasty, time to go. Please don't wear a dirty mask. Even if you're like, oh, this is KN95, it's special. It's not that special. It's not worth an upper respiratory infection, okay? So as soon as it looks icky or smells icky, it's time to go. But you should be able to get anywhere from 5 to 8 wears out of it if you're being careful. And just when that 8th wear is done, get a new one and throw it in the rotation. So that's it. Just remember, take care of your mask and it'll take care of you.